Since I had my first breast augmentation and it went really well, I've thought about maybe getting lipo in my legs, having fuller lips, and a nose job. I want to get lipo on my legs because I probably could go to the gym and get it done, but surgery's a lot quicker.
Well, we're talking to teen girls who admit that they're either obsessed with having the perfect looks or they feel forced to change their looks by cosmetic surgery. Now, 18-year-old Ashley says that she wants a second breast implant surgery to increase to a double D cup size because, in her words, pretty people get more opportunities in life. Now, her father Mark and stepmother Sherry say they do not want her to get another surgery. Okay, and you think double D is prettier?
Well, to me, it's pretty. I wouldn't go and say that's pretty for every girl or, you know, a cosmetic surgery is right for everybody. But for me, that's pretty for my body.
Dad, what are you concerned about? What kind of message this sends about her and what kind of sexual magnet it becomes?
I think it's, you know, attracts the wrong guys. I think if, you know, she walks into a room, they're not going to say, wow, how smart she is. They're going to say, look at her breasts. That's that's the first thing they're going to look at.
Yeah. And is that a message that you want to send?
No, not at all. I just want to feel attractive when I walk in a room.
You are intelligent. You are a very pretty girl. You're very industrious. You have so many qualities and characteristics that it will actually detract from. It will actually send a message that, because you don't think this is going to look natural, do you?
No, I'm sure it won't.
Because it's not a natural look. The only place you see women that have 44 double Ds is either at the clinic waiting to get a breast reduction because it's killing their back, or you see them working at a strip club or something like that, which is so not who you are. Dr. Rose, she has implants to a C.
That's right, Dr. Phil.
Okay, let's see a C.
This is a C cup right now, which
That's
is
a C cup.
That's what Ashley has. She started as an A cup, about 1/4 pound. Of course, double D, which we're not recommending, we don't. Ashley is very beautiful the way she is, and I think, you know, given some second thoughts with you and her father, that she'll probably stay right where she is.
What does that weigh?
This is about 1.5 pounds, so it would be an extra 3 pounds on the upper torso.
And what effect does that have spinally and back? I mean, that can't be comfortable.
It could cause back pain, and the saline C implants that we did are just beautiful for her, and so we're really not recommending any further surgery for her, Dr. Phil.
Okay, you wouldn't do the surgery?
No, sir.
Why not?
Well, I just think, you know, anytime you do surgery on anybody, there are various risks and complications, bleeding, infection. Sometimes it's best to just leave things alone, and in her particular case as well.
When you do that kind of surgery, breast augmentation surgery, the recovery is just like a week as far as being able to go back to work and things of that nature, true?
Oh, not even. I think we did her on a Friday and she was back at work on a Monday. The technique that we use is rather pain-free, and so the recovery is very, very quick.
But how long is the healing inside before you could go back in and cut again?
Oh, you would want to wait at least 6, 8, 10, 12 months, something like that.
Okay, so a good while, because there's scar tissue problems, you could have bleeding, all sorts of complications.
Inflammation and things of that nature, yes.
Yeah, okay. So at this point, how much is too much in your opinion? At what point would you say, I've gone too far?
Well, I think if I could have my second surgery after that, I definitely wouldn't try to. The weight thing just kind of threw me for a loop there because I'm on my feet all day, but so
it's 3 pounds, and it doesn't sound like a lot, but I mean, the spine's very delicate. What do you want to say?
No, I mean, you know, I've learned that, you know, when you say no to, you know, an 18-year-old, I've got a 17-year-old various times, and when this whole thing started, when she wanted implants, she was, you know, flat-chested and she had a problem with it. So therefore, we went to fix that. You know, obviously I'm afraid that, you know, it may lead to my nose or my hips or wherever it may go, and you know, got to stop that.
And you said there are other things you would like to do.
Well,
you're not hot to do them, but you'd like to do them?
Well, since I've had plastic surgery and, you know, I had great results, Dr. Rose was great, I healed quickly, it's kind of opened up my mind to maybe other possibilities, like, you know, if it's not that big of a deal, why not just go ahead?
Well, you saw the tape that we played right before you came on with a young woman that died in an elective surgery procedure, because there's no surgery that's minor. There's no, I mean, if you're going under anesthesia, you know, what they say, minor surgery, something they do on somebody else, it's all major to you. And, you know, but again, aside from the risk of the surgery, I think it's so very important for me to say to you psychologically and psychosocially, the psychological and sociological aspects, that you can define yourself in a way that really sends a wrong message. It probably may not make sense to you at 18, but if you went to a 44 double D breast augmentation, I promise you that would become a defining, if not the defining characteristic of how you're perceived by others. And that would be such a disservice to you. And if somebody's told you that that's something to aspire to, it's a very one-dimensional aspiration. Would you agree with that?
Absolutely. I think it attracts the wrong characters. You know, I'm big on also her, you know, finding the right guy in her lifetime. I don't want, you know, I raised her to be independent, working and doing the stuff, not to be dependent on a guy. That's the reason I got him in the first place. I didn't want her to have to owe some guy that bought her implants.
Exactly.
So, you know, now that we've got that done, I mean, I just think bigger implants will cause definitely the wrong characters.
You know, and I've talked to so many young women because I spent a lot of my career screening for cosmetic surgery, where responsible surgeons would send a patient and say, I want to be sure they're doing this for the right reasons, have the right objectives. And I have actually said it made sense for young girls to have procedures at times if they had something, I mean, if they were so flat-chested that there wasn't a fashion in the world that would fit or that would work, or if they had some type of ear or nose or whatever that had become a defining characteristic for them, that you could take them out of feeling conspicuous. There are right reasons and wrong reasons to do this. This is not a decision that you're ready to make. I mean, even if you could find another way to pay for them, I promise you there's plenty of time to do this. You need to live with where you are and what you have at this point, because it's kind of hard to unring a bell when you stretch things out. I mean, they can do reductions, but I can promise you it's going to become a singular defining characteristic that's going to send a wrong message. So what do you think?
I think, you know, you're right. I probably should put some more thought into it, and I think it's something that I should probably wait maybe a little
But you've heard of something called typecasting, where if somebody is a certain type, they can only play certain roles, and the typecasting that would come with that kind of surgery would not be what you're looking for.
Yeah, definitely not.
I promise you, would not be what you're looking for. So, you know, put this on the back burner?
Yeah, I'll put it on the back burner.
Because you can't afford it anyway, right?
Yeah, I can't afford it.
She's also got a 7-year-old sister that's watching really close. You know, we're going to have to deal with that someday, hopefully a lot longer from now. But
yeah. You are a powerful role model for that little sister, a powerful role model.
And I understand that. And like I said, this isn't something that I would advertise to every teen out there. They need to go get plastic surgery. This was just something that I felt. But I do see how, you know, because I watch her now trying to, you know, wear clothes like I wear or act like I am. And
all right, coming up, a 17-year-old girl who says it's not only time for breast implants, but also preventative measures such as Botox for her crow's feet around her eyes and lip, and cheek injections.
I'm 17 years old, and I'm very serious about wanting to get breast implants. I could also see myself getting lip injections as well as Botox.
Tracy is very, very headstrong, and she's not going to give up on this.
I don't want to look like a bimbo or anything like that. I just want to be more full.